Since in the morning session, most of the clinical aspects of meditation have been covered both by Dr. Nagaratna and Dr. Hemant Kumar, I would focus on certain other things that would actually make us, that would throw some light upon why Indian medical systems should be looked into once again. We have lost there is so much of medical potential in our Indian medical systems, and the clinical aspects that we can look into and take advantage of. That's what I would like to focus on this presentation in this particular session. Here, I don't know if if any of you have heard about this story. This is about Kisa Gautami. This is the story of Kisa Gautami. There were, it's not only that in today's time we have psychiatric illnesses. 2500 years back and prior, wherever there is the human world existing, the problems were also existing. So this is the story of Kisa Gautami. She loses her child, and then the child was only 5 years old, and she loses her boy. Then she doesn't accept the death of her boy. She carries on the body with her, and then runs through all the streets, and then never allows the body to be cremated. That's when people have pointed her. Finally, they said she has to go to the Buddha. Nobody can really help her come out of her agony. That's when Kisa Gautami goes to the Buddha. Then what the Buddha says is, this is a simple story that tells she asks Buddha to give back life to her child. Buddha says, fine, I'll do that. But just I need some favor where you can go to a house in the city and get some few mustard seeds, and the mustard seeds should be from a house where no death has occurred. Then Kisa Gautami is so happy, jubilant, that she runs. She thinks that her child is going to come back to life, and then she goes house after house, and then finally she realizes that every householder will be very happy to give her some handful of mustard seeds. But when she puts them the question, some death occurred, then they'll say, oh, my daughter-in-law died, or some father-in-law, or some death incident has occurred in the household. So finally, in that process, she comes to the realization of the impermanence. This is what I have talked in my earlier session about the vulnerability of human existence, and when we hold on to something that is not permanent, that is eventually going to give rise to suffering. Then in the process, Kisa Gautami will understand, and actually it is later said that she becomes an arhat. That is because what I am trying to say from this story is not about, it is the change in the outlook. I have also mentioned that Pancha is the five sense organs, Pra is the extension of the five sense organs. The way we look at the world is the reflection of our mental state. So if you change your mental state, then the world is going to be fine. We cannot change the external world, but you can change what can happen to you. Within you, you are in control. We are the choosers. That's what Buddhism emphasizes upon. And you want to remain in this state? Fine. You are not even aware, you can still remain in that state. You want to come out? Yes, there is a way. This is what, so there is so much of, probably there was a method how Buddha has brought her out of her problem, which is the point of focus of the current day integrated medical approaches. And this is also the story of Patachara. Patachara, in fact, loses all of her family. In today's terms, probably she has become an insane schizophrenic, where she started hallucinating. She has thrown her clothes out, everything. And then when she was brought to Buddha, she understands, she realizes, and she becomes normal. Maybe there is something that our Indian systems are telling us which we can take advantage of. And one more thing, even the story of Angulimala also conveys the same thing, where a violent criminal has changed for the good. So here, this is one more thing that the two-arrow parable, it is called the Salatha Sutta. where Buddha talks about two arrows. Like suppose somebody has got a physical pain. It is like, I'll just read this out. Physical pain, the Buddha taught, is like being shot with one arrow. The person who does not resist physical pain feels only that arrow. That means if you accept the pain, only one arrow is like shot at you. But however, an average person who experiences pain also adds a layer of emotional suffering. Anguishing over pain is like being shot with a second arrow. So the pain is getting doubled. So there is, in addition to the existing pain, you are giving more pain. So this emotional processing, the effect of mind over the matter, this is what takes precedence in our Indian systems, and it is that which is targeted. So meaning of the pain is more than the pain itself. It is how much importance that you give to the object, because same objects will not cause same responses in all of us. So it is the meaning that we are giving to the object that is making all the difference. So for example, why can't we can also apply this to our modern medical system. Here also, these are all case studies and from of the medical books that I have bought. This is a patient with soreness of throat believed herself to have cancer. So she has exaggerated her pain to such a level as to believe that she has got cancer, and she is down with depression, and she has so many other things as an add-on effect to the simple sore throat. And then there is another person who believes that she has got a venereal disease, and she has never been exposed to the risk in her life, but she believes. So and then there is another person, what is the subjective experience of a person who complains of severe pain, and all the tests show that there is no organic pathology detectable. So these all point out to a mental state. Can we address that? A person with mild pathology complains of excruciating pain, and sometimes a person with where we expect a severe complaint of pain, a person may just laugh it off. So we do not know if it is the mental state or if it is something pertaining to the actual ailment. A person apparently with severe injury who claims that he has not noticed any pain at that time. So this is, we can to some extent say the analgesia effect and all, but there are cases that we cannot really pinpoint to and come to a reason, come to a cause. So the power of mind, all of the Indian traditions have been exercising the power of mind to control physical states is well recognized in Eastern cultures, and emphasis is now on yoga, meditation, relaxation techniques, hypnosis. These are all the ways, and from this recently using the Vipassana meditation, using the mindfulness component of the Vipassana meditation, many mindfulness based interventions have been in vogue at least from 1980-83. These interventions have come into existence, and clinical interventions based on MBSR is mindfulness based stress reduction therapy. As I told you, mindfulness is one of the core components of Vipassana meditation, and using mindfulness, these interventions have come up: mindfulness based cognitive therapy, dialectical therapy, acceptance and behavior therapy, and they have become part of the integrative mind body training methodologies. And these programs share an 8-week instructional format, and the results are often very positive and encouraging. And all this is happening because actually, as I told you, the inner state of mind is getting transformed or changed because of the meditative training. There is a refinement in the faculties of attention, concentration and awareness. So the cognitive component is being affected, which is actually making the person become more sensitive to the inner happenings of his body mind. That is increased sensitivity to the sensation. Sensation means our own feelings. You become more and more sensitive to that because we react to our feelings. And then we start understanding, discerning the characteristics of the internal phenomena. That is, they are not going to last long. They are going to give rise to pain and suffering. So you start analyzing the body just like an anatomist dissects out the body. Here a meditator will dissect out his own body in terms of his experience. And then this change in the internal, the discernment of the increased internal awareness will actually make him cognitively reframe his experiences. Now he doesn't look at the same object in the way he used to look at it before. So he is now with a better alertness, better mental balance, which is actually giving rise to a sense of calmness. This is an overall process that is occurring within the meditator. Actually what is happening is, and several research studies have shown that there is increased metacognition, insight into one's own thinking process, there is a decreased rumination, and as I told you in one of our earlier studies, we have showed that the negative wave has come down in teachers. It is because there is a decreased rumination, decreased pondering over what has happened. And then there is also a process that is occurring because of meditation, is decentering. That is, actually you don't give so much value to that capital I, myself, me. That thing is coming down. When you attach less importance to these internal phenomena, this is what is called the decentering is happening, and then actually you start reperceiving the stimulus or reperceiving the object with a clear vision. So all of these things are occurring, changes are happening, and so that, and many of the therapeutic intervention based studies on meditation have, as we have already shown, suggested increased gray matter concentration in left hippocampus, in posterior cingulate cortex, temporoparietal junction and cerebellum. These are all the areas involved in learning and memory, emotion regulation, self-referential processing. At this point of time, I would like to, this slide actually I have showed you. This is where the decreased, this negativity is not seen in practitioners who have practiced for a long time. This is actually statistically significant, showing that there is a change in the processing mechanisms. Here I would like to, these are some of the earlier studies, because I am not going to stress more upon that, as Dr. Hemant Kumar has already covered. There has been an effect, obsessive compulsive disorders, anxiety disorders, depression, drug addiction, post-traumatic stress disorders, all have been improved. And then in the physical plane, immune functions, blood pressure, cortisol, chronic pain syndromes have been addressed with meditation. This is all because of positive self-representation, higher acceptance of oneself. These are bringing these physiological and pathological changes. And another thing is, there is one more aspect called social pain. So, suppose somebody insults us, humiliates us, or we feel rejected, dejected and all. This is all happening because, and the social pain, the pain because of the social circumstances is traced to the dorsal anterior cingulate cortex, and studies have shown that anterior cingulate cortex and orbitofrontal cortex, mid cingulate cortex, all of these regions are getting affected through meditation, and the activity of anterior cingulate cortex that is impacted by meditation is found to be lessening the social pain. And also I would like to throw some light upon the Vipassana Research Institute, which has published several papers on bringing reformation in individuals, and studies have been conducted on people addicted to drugs, and in adolescents' health and behavior also the meditation has shown very good impact. And then studies have been conducted on Tihar jail inmates, and for the first time the criminals who are they could realize where they have gone wrong, and they could realize the intensity of agony that they have created to the victims. So they could realize that internal state of realization has happened, and there was a total change in the mental state of these Tihar jail inmates. And the Mind Life and Institute under His Holiness is also conducting several studies, which I could not mention here. There are so many to add to this, on destructive emotions, on addiction, psychology, and ethics. There is so much to add on to that. So there is so much of clinical potential that is there hidden in all of these Indian medical systems that we can tap on. Thank you so much for giving me this opportunity.